As you can see, we will be recording today's session. And if you haven't already done so, if you could put your name, organization in chat, that would be great. Go to the next slide, please. And we really want to hear from you. So please, engage in chat. Let us know what you're thinking today, in terms of health equity. Have you looked at the assessment tool yet? What tools and resources are you using in success stories? So, and we'll also be trying some polling questions and look forward to your participation in those as well. Thanks so much. Next slide, please. As many of you know, iPro is the QIN-QIO for 11 states and DC. Next slide, please. And iPro is also the HQIC for these 12 states. And we'll be sharing website and contact information in the chat and later on in today's session. Next slide, please. So without further ado, I want to turn it over to our speaker for today, Laura Benzel. She is the Health Equity Lead at iPro, and she's been really leading this effort on the HEOA, and we're really excited to hear more about it. So thanks so much, Laura. It's all yours.
Thank you, Laura. Good afternoon, everyone. It's great to be here, and we appreciate you joining us. So as Laura said, today we're going to be providing an overview of the Health Equity Organizational Assessment. I'm going to be calling it the HEOA moving forward because the full title is a mouthful. So just to reiterate, we're doing the overview session today, and the one next week is a repeat. It's the same exact information. We just wanted to offer flexibility to folks as to when they attend. So you're welcome to attend both, but just so you know, it is the same information in both sessions. So we're excited to be doing polling questions for the first time in our small talks. So please bear with us in case we have any technical issues, but it looks like we're good to go. The first question is, does your organization have a team working on health equity? So we really appreciate you giving us response. Remember, responses are anonymous. So just let us know if you have a team, yes, no, or you don't know. And that would be really helpful for us to know. Do we have any responses, Ryan? Oh, great. So it looks like about 81% of the attendees do have a health equity team. That's excellent. And about 20% aren't sure. So thank you so much for replying. That's really great information to have. So, okay, a lot of information on the slide. I apologize for that, but I wanted to make sure that all this information is on here for when we send the slides out. But just to give you a synopsis of what's on here is that eliminating health disparities really requires the collection of meaningful patient demographic data. That's really foundational to identifying and addressing disparities. And that's what the HEOA is all about. When organizations complete the HEOA, it really gives them the opportunity to assess their ability to collect, validate, stratify, and analyze patient demographic data. So when you do the assessment, we provide you a report, and the goal is to use that report to really develop an action plan to address opportunities for improvement. And of course, this overall will improve health equity. So that's the whole purpose of this whole initiative around the Health Equity Organizational Assessment. So just some quick background for those of you who may be wondering, where did the HEOA come from? Well, it was developed by the CMS Partnership for Patients Initiative, and they had an excellent health equity group that worked really long and hard to develop this HEOA. And the reason they did that, again, is just to give hospitals a way to better understand their preparedness to address health disparities, again, through this standardized process for collecting accurate patient demographic data. So the focus of the HEOA is on race, ethnicity, and language data, also called real data. But it also includes additional demographic data such as social determinants of health for those organizations that are collecting those additional data. And we also want to mention that CMS highly endorses the HEOA as a really valuable tool that can help promote health equity. And so that's why we're offering this to both HQIC and QIN-QIO participants. So again, as I mentioned, accurate patient demographic data really is foundational to providing equitable care. And that's the whole reason that the HEOA exists, why we're using it and sending it out to facilities to take action. And it can help you determine your readiness to collect that accurate patient demographic data, to use that demographic data to ID and address disparities, and also to implement organizational infrastructure and culture to deliver equitable care. So I'm going to talk about the 7 categories of the HEOA, but first we have another polling question. It would be wonderful if you could tell us, did your organization receive and complete an HEOA from iPro? Have you submitted one? Is it in process? You're considering and going to be submitting it, or you're not sure? We'd love to hear that information. Do we have responses, Ryan? Oh, great. So about 47% of attendees have submitted an HEOA, about 13% in process, and 40% are not sure. This is good information. I appreciate it because I am going to be giving a little bit of information about the HEOA. Those of you who have completed it will already know this, but I'm just going to do it quickly for those who haven't and may be interested in taking the assessment. So thank you so much for answering that polling question. So the HEOA is divided into 7 categories, and these are the 7 categories, and there are a series of elements beneath each of these categories that organizations can go in and check, yes, we're doing that, no, we're not doing it, or we're not sure. And then that data is then rolled into a report that iPro provides to the organizations. And I'll actually be showing a sample report shortly here. So these are the 7 categories. And what I'm going to be doing now is actually showing you the assessment in REDCap. What we've done is we have sent out a link to organizations. They click on the link, they complete the HEOA assessment in REDCap, and then we roll up that data into the report. The good news is, for those of you who have not taken the HEOA and are considering it, there's still time to do so. We are going to be keeping the assessment open until June the 14th. If you're interested in, contact your iPro QIN-QIO or iPro HQIC team member or support person, and they will get you the link. We also have a QR code, so if you want to use your mobile device, you can scan the QR code and that will bring up the assessment as well. It takes about 15 minutes to complete. Of course, that assumes you have the knowledge about your organization's processes for those 7 categories. So we also have this assessment in a paper form, a PDF form. So if you need to meet with staff members to really answer the questions first before you actually put the data in REDCap, because we understand you may need to pull other folks in your organization into this process, we can make that PDF version available for you as well. I'm also going to be doing showing you a sample de-identified HEOA assessment report and discuss the report scoring. So I'm going to hop out of PowerPoint and I'm going to pull up the actual HEOA assessment. So this is what it looks like when you get that link or that QR code. This is the assessment in REDCap. It's pretty simple to follow along. This is just information about your organization, what's your facility type, your state, your zip code, who's completing it, their title, their email, phone number, and the date. So just quickly go through that information. And then we actually go into the 7 categories. So you can see here, the first one is data collection. And you just check off the elements that your organization is already doing for this particular category. So for example, if you're already using self-reporting methodology to collect real data, you would click that one. If you're doing none of the above, you would click this last box. Down here, we just have some best practices for each of these categories, just a little additional information. So you go through each of these 7 categories, click whatever is applicable for your organization. And then when you get to the end, you just hit submit. It's pretty simple. And again, if you have all this information at your fingertips, it takes 10 or 15 minutes to complete. So I'm just going to briefly pause and see if anyone has any questions, anything in the chat. Let me stop for a moment and see if there are any questions.
Questions in the chat, Laura.
Okay, great. Thank you. Okay, I'm going to stop sharing the actual assessment, and I'm going to pull up a de-identified report. So once you complete that assessment, we roll up the data into an assessment report. And this is what you will receive from your IPRO representative. Health Equity Organizational Assessment Report, your hospital or facility name will be here. We have a nice letter just explaining what we're providing to you and who's providing it to you, your team member from IPRO. And then on the next page, we actually talk about the scoring. And we've had a lot of questions about this, so I'm just going to take a few minutes to talk about the scoring. So again, we are assessing these 7 categories, and the key activities or elements within each category and the sequence of how you implement those correlate to 3 hierarchical levels that determine scoring or assessment. So if you complete it and you see that you have a check mark next to basic, what that means is that your organization checked all of the activities under basic. You may have checked some of the intermediate or advanced, or you've only partially selected them. So that's how you got that basic level. To get intermediate, all of the basic activities must be selected first. All the intermediate activities or elements must be selected, and that's how we determine an intermediate level. For advanced, all the basic have to be selected, all the intermediate have to be selected, and all the advanced have to be selected, and that's how the advanced score is calculated. So it really is in sequence. You have to complete the basic and complete the intermediate in that order in order to advance to the next level. And that's just the way that CMS set it up. So as you're going to see in this report that I'm going to be showing you, for example, here you see under category 1, data collection, this organization did select one of the basic elements. They selected one of the intermediate, and they actually selected one that's pretty advanced, but we don't use that for scoring, and that's the use of Z codes. But they received no score. And the reason is because they didn't complete the second basic, they didn't complete the second intermediate, and no advanced. So we just say it's no score. But this is where there's an opportunity for improvement. If the organization decides to go back and roll up their data to the OMB categories, they can then select that. They can then look at opportunities for data verification, then they can select that. That's the whole purpose of the report. It's just to give organizations insight into where they can actually improve on these elements. We also provide some benchmarking here. So this is this organization. They have no score for this category. And as you can see, for all of the hospitals that have participated, 50.4% are no score, 24.4 is advanced, 4.7 intermediate, and 20.5 basic. So it just gives you some insight into aggregate data for all of the hospitals that have submitted the HEOA. So on this particular category 2, you can see the organization checked all of the boxes. So they received this advanced score for this particular category. There's a few where, let's see, they actually are not doing any of the above. So that's, again, equates to no score. For data stratification, communicating patient demographic findings, they're not doing any of the above. And again, it's just providing some insight and some things they can do to, improve communicating patient demographic findings. So that's the whole purpose of the report. It's just to give you some insight into where you can show some improvement. So I'm going to stop and see if there are any questions about the scoring, the report. If you received a report and have a question, feel free to ask. Any questions, Pooja, in the chat?
None so far.
Okay. So I'm going to stop sharing, pull up the presentation. Oops. Okay. So this is our final polling question. Again, we would appreciate your input. Does your organization have an action plan or a process for making improvements in any of the 7 HEOA categories if you completed, obviously, if you completed the assessment? So yes, you successfully implemented in the process, plan to in the future, no plans, or don't know. We'd love to hear if the reports are helpful, if you're using them to ID some areas for improvement, or if that's in process or you plan to do so in the future. Okay, Ryan, if you could share the results. So great, it looks like about 18% in process, 55% plan to in the future, that's great. And about 27% don't know. So that's wonderful. Thank you so much for sharing. We really appreciate that. So as you go through this process, we have created a variety of resources that can help. We have all of the resources within one link, as you can see here on the slide, in our iPro resource library. So when you click on that link, all of the resources are consolidated in one place. We have an HEOA roadmap, frequently asked questions. We have a one-pager for the executive audience. If you have leadership that's questioning why this is a valuable tool, that's a nice resource for them. We have best practices for health equity data collection. We have a real data collection toolbox, the importance of health equity metrics, and this is for those of you participating in HQIC, and also collecting real data, examples of how to ask for the data. So we know when you're training staff, sometimes there's some discomfort around asking patients for this information. So that's a great tool for how to get staff comfortable for asking the questions, and also how to stress the importance of why this information is important to the patients so they feel more comfortable in sharing it. So again, you can access all of these in this link, and I think Pooja is sharing that in the chat as well. So as I mentioned, we're providing this overview session today and also a repeat next Wednesday, the 25th. There'll be a 2-week lag, and we're doing that because if there are any organizations out there that are interested in completing the HEOA, you'll have 2 weeks there to complete it. For those of you that have already received your report, that'll give you opportunity to review your reports. If you do complete an HEOA between now and June 14th, we will definitely turn around your report and make sure that you get it promptly. And then starting June 16th, which is a Thursday, And every Thursday on a weekly basis, we will cover one of the categories, and we'll do a deep dive into each of the 7 HEOA categories. So the way there'll be a 30-minute session, we want to maximize your time and make the information really, really valuable. So we'll do provide some information in the form of a brief presentation on the actual category. And then we're going to have guest speakers from hospitals and other facilities who scored well or did well in a particular category, and they're going to share their best practices, their experiences around implementing those elements, and then open it up for questions and answers. So as a participant, it's going to be really valuable because they can share their information and you can ask them questions and hopefully get some great ideas about how to implement all the elements for each of these categories. So we'll cover all of the categories up through July 28th. And then on August the 6th, we'll do a recap and do a final like office hours or question and answer. You can register and get all the information about the sessions through this link, which I believe Pooj is putting in the chat. And the good news is it's through this link, the single link, you can see all the sessions, register for any or all of the sessions. And also when we post recording and slides, you can access those from the single link as well. So that link is everything you need to access information about the Knowledge Builder series. Again, starting on the 16th, it'll be every Thursday from 12 to 12:30 Eastern Time. If you are interested in doing the assessment and haven't already, or if you have questions, we encourage you to first reach out to your iPro HQuick or iPro QIN-QIO team, QI advisor, or contact. If you're not sure who that is or have any issues contacting them, you can then reach out to Stacy Doris for HQuick or myself, Laura Benzel, for the QIN-QIO, and we're happy to answer any questions or put you in touch with your team member from iPro. But again, start with your iPro and HQuick and QIO team first. So I'm going to hand it back over to Laura V to moderate the chat.
Thank you so much, Laura, for that great overview. I always learn something new, and we do have a question in chat. So Pooja, why don't you let us know what that is, and we'll get this Q&A started.
Will do. So one of the questions that came in was just about whether this will be recorded and if they have access to review this presentation again. So as Laura mentioned, the link that I shared with the Knowledge Builder series, they'll post the recordings and slides on there, so you'll have opportunities to review it again. And then a reminder that next week, the session is a repeat, but if any of your colleagues would like to join in, please, ask them to register. The next question we have is, can you share any examples of how this assessment and knowing these results improve health equity for patients?
That's actually a great question. So again, as we mentioned, really being able to collect accurate data, demographic data about patients is really foundational to addressing health disparities. So if you're collecting race, ethnicity, and language for your patients, and in the HEOA, you'll notice we say to strive for 95%, if you can, of your patients to have that information in their electronic medical record. You can then stratify the data to see if the services that you're providing are being provided equally across all of your patient populations. We know that all of organizations strive to provide equal access, but sometimes unless you do that deep dive into the data, we're not really sure. That's really the only way to identify those disparities. So accurately and consistently collecting those data. And remember, we talked about race, ethnicity, and language, but you can also collect additional demographic data, such as sexual orientation or gender identity, geography, educational attainment, housing insecurity, all of those social determinants of health that we've talked about. A lot of organizations are now collecting those data as well. And when you're speaking with patients or providing care, having those data are really provide insights into why they may be having issues in getting care, or why they're not taking advantage of the services that you offer. So again, those data really help to identify gaps between different populations that you're serving.
Thank you so much, Laura. And so, we definitely have time for a few more questions, and you can either use chat, or if you want to take yourself off mute and ask a question, please do so.
Yeah, I guess I'll ask a question while we wait for others. Once organizations receive their HEOA feedback report, what would you recommend they do as a next step?
Yes, so the recommendation is to form a team that can go through the results and determine really where you'd like to start as far as doing, addressing opportunity for improvement. So we suggest taking one category and picking one element. Something interesting that I noticed under data collection is that many organizations did not select one of the elements, which is rolling up to OMB categories. And we're going to address that in the first session on June the 16th, but just using that as an example, an organization may not know what that is, or they haven't done it. And so that would be an opportunity to get together with your team and say, we really want to address that element. How do we go about doing that? And that's one way to show some improvement, basically address how do we roll up our data to the OMB categories. And then, start with that one element and then move to the next element. Obviously, you would want to go through the 7 categories and decide as an organization, which element is a priority that you'd like to address. But form a team, determine an action plan to basically address those elements. And I should also throw out there that iPro is here to support you. We have all those resources. We're happy to provide support in the form of a phone call. Anything we can do to support in this process, we're here to help you in addition to the resources. So feel free to reach out to us, and we're happy to help.
Laura, we do have another question. We have 2 people who are asking about, they're in very rural states with limited diversity, and it's challenging to use the data well since there's so few numbers, and wondering if you had any suggestions related to that.
We do. That's a great question, and we do hear that. So if you can collect additional data beyond race, ethnicity, and language, such as the social determinants of health that we talked about, that might provide some additional insights into your population. So, housing insecurity is a issue. Food insecurity is another one that you might start with. Educational attainment, income, some of those social determinants of health are really valuable to look at. And you don't have to collect all of them. Again, start with one. I know a hospital that started with food insecurity, and it really provided some insight into some of the challenges that patients are having. Some patients walk in and you would have no clue that they're dealing with that. So that's a suggestion. And we have some tools that help you to assess for social determinants of health. So that would be my suggestion for those areas where race, ethnicity, and language is not really relevant for your patient population.
Thank you so much, Laura. Next slide, please. So thank you so much for those great questions, and we definitely encourage you to reach out to us. We're here to either help connect you with the HEOA assessment, or those resources that Laura mentioned, and help you get started. And with any other needs that you may be trying to address. So next slide, please. So here's our homepage, and if you can access the iPro HQuick or the iPro QIN-QIO websites and resource libraries by going to About Us at the top there, and use that drop-down menu, and you can see what else we have on the website to get you started. Next slide, please. Your feedback is really important to us. So please, let us know how we're doing. And, we'll be sending those surveys out as follow-up after this session. Next slide. So thank you everybody so much for being here today and for your commitment to health equity and to healthcare improvement. And I hope you have a great afternoon.